Well, you read a lot of different numbers on that. Um, a lot. I keep hearing 30 million. Over the past year or two, I keep hearing the people say, that's like, how many illegal immigrants are in America? Well, I keep hearing all kinds of numbers. I don't know which one's really right. Uh, yes, the state, not the federal government. Well, isn't that brilliant, right? It's a state-funded program, not a federally funded program, right? So now, we'll talk about that, but every state had the option of passing new Medicaid rules. And Kentucky and Illinois passed them, and Indiana has declined to increase the Medicaid eligibility criteria up until so far. But let's say it's 30 million, okay? Noise now is whether or not any of this is actually going to reduce the number. Well, because like the people that I read that are signing up for the exchanges, and there's more people signing up for the exchanges now, but they're not the uninsured. There are people that did have some kind of insurance, but are signing up because they're wanting the subsidy. So the trick is getting the uninsured, the people that don't have any insurance, getting them in to get them to sign up to get subsidized health insurance. And I think that's the trick, is to get that done. And maybe ultimately that will get done. Okay, the question is, how are the uninsured being made aware of how to go about and getting this insurance? And there's a variety of things built in the act to cause that. I don't think you have really seen the beginning of the PR campaigns. You've seen, well, you have seen the beginning. But we got lots of public information that will be a lot of money to spend on announcements and ads and TV ads and that sort of thing. Navigators, have you heard the term navigator? These are people trained to kind of help people to understand how to do things. And I don't know how they'll ultimately get those 30 million in, but somebody in the suburbs of Washington have figured this out, and they've got these plans, I'm sure, worked up on it. So let's keep them moving on. Okay, yeah.
I just want to know, how are they, the uninsured, supposed to pay for this?
Though they don't.
That's what I thought.
They don't, and I'll show you how that works, and you'll be thrilled, I'm sure. Okay. Okay. The individual mandate, that has actually kicked in, right? Other things haven't kicked in, okay? This is the penalty. So let's say that by March 31st, you are uninsured, okay? Let's say by the time next year rolls around, you're still uninsured. How is the government going to find out if you're uninsured? Does anybody know? Your tax returns next year will have a box for you to put down your health insurance information. Okay? And if you don't have that, then who in the world would collect a penalty? Oh, you all know it. Come on. The IRS, right? The IRS. They'll collect the penalty. So if you are getting a $937 refund from your income taxes, but you owe a penalty, they'll just actually keep some of that and send it over to Catherine Sebelius. And she'll send you a thank you note after that, right? But here's the penalty. It's both based upon percentage of your particularly adjusted gross income, household maximum of $285, roughly $95 per adult, and your accountants will figure all this out on your tax returns if you don't have it. But
That amount per year or month?
per year. Per year. But see, I'll give you a good example of one of the dichotomies with this. I was talking to a friend of mine that has a daughter that's graduated from college. She's struggling to find a good, decent job and working hourly jobs until she can find something. She can either pay for health insurance for her. She doesn't. He says she's very healthy. Why does she need health insurance, right? You know, pay $2,000, $2,400 a year in health insurance, or what? Pay a fee of $95. You know, which should she do? You know, that's one of the loopholes in this. Now, there's some of the scuttlebutt is that these fees are not high enough. They need to be made higher to incent people to go get their insurance. There are several individuals that actually are exempted from the Act that do not have to have health insurance. You'll see some of the folks on that category. I put this because we're going to talk about hardship exemption. At first, I couldn't figure out what in the world did that mean because there's subsidies, right? I couldn't figure that out. But undocumented immigrants do not have to have insurance. Okay. Okay. We have lots of provisions already in effect from the Affordable Care Act, and many of you are familiar with that. These have already come into play. Coverage for the dependent children up to age 26 that was just mentioned. Health flexible savings account limitations. The launch of the health insurance marketplaces. Those are the websites. And they got up and going, as you know, in a kind of a rough way in October. And the current status, what is it? The best I can tell you, the current status through the end of January, this was 1st of January from Bloomberg Business, the demographics of the people signing up, the Health and Human Services are promoting the fact that the 26 to 44 age group is growing. But if you peel away the onion a little bit, the other thing you learn about is the 26 to 44 age group, not a lot of them are paying for it. And the idea is that this would be the group that would pay for a lot of insurance but not use a lot of insurance. So maybe those demographics will continue to change. The people that have signed up so far, roughly about 3.3 million as of the end of January, up from 2.1 million at the end of December. 79% are signing up for subsidized health insurance in one manner or the other, and without a subsidy, only 21. And I think HHS is wanting, of course, this wedge to grow a little bit so that it can pay for itself. So how many? 3.3 million Americans enrolled, but there's an issue as far as paying for this stuff. So a lot of these folks have enrolled, but very few of them have really started paying for any of it. So they've signed up, but the information as far as how many are enrolled and have been paying, the information hasn't been coming out of HHS yet, and not releasing on how many have actually started paying yet. So we don't know that information yet. So they are signing up more and more people.
When you pay, is that money going directly to the insurance company that you somehow find through the exchange, or are you going through the government to that?
That's a multifaceted answer because people are getting insurance either through their employers and through the exchanges, or just going on to the exchanges like you were explaining. I don't know if you even got that far as how you would pay for your insurance. But you know, that's like you pick a certain kind of plan. They got various levels of coverage, and you say, well, I want a silver plan or a bronze or a gold or platinum or whatever. And different companies in Indiana are offering those plans through the health exchanges, right? So like Anthem has the most plans in the system, and the people on the phone that are click, 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 you know, say, okay, well, we got you one. It'll cost you $337 a month. They're talking about an Anthem plan, perhaps. or some other plan, perhaps. And of course, I haven't done it, so I don't know. But somehow, then you get hooked up with that plan.
But then you're paying the
Yeah. Yep. Okay. Here's where the hardship exemption comes in. So the individual mandate, we now have a law that says that anybody that's had their health insurance canceled as a result of the Affordable Care Act now qualify for the hardship exemption, right, where you're not subject to the individual mandate. I don't understand that entirely. But what that's saying is that if you've had your health insurance canceled, you're not going to be penalized if you don't go get health insurance on the insurance exchanges. So an estimated 5 to 7 million Americans who've had their health plans canceled, now they've gone and said, well, you don't need to go get insurance because you have a hardship exemption. Eventually that'll come around and be changed. But, well, they do need it. They're just saying we're not going to tax you for it. It's another one of the modifications.
How long does the hardship last? The exemption, is it 1 year?
I think it's just going year to year, and they're extending it from what I can tell.
Okay.
Yeah. So, see, I don't understand how those two dots connect, because it was meant to get the uninsured insured, and now we're exempting the uninsured from having to get insurance. But that's what I do. But they'll get it. They'll eventually come around and change this. But currently, that's the setup. The employer mandate I'm going to talk about here in a second has also been delayed. That is the information you're seeing in the news this week. All right. So the employer mandate, and that's all based upon any employer above 50 employees have to provide health insurance or be subject to a variety of penalties and taxes. Any employer under 50 do not have that requirement. Okay, so if you've got 20, 30, 40 employees, you are not subject to the Affordable Care Act's requirement that you provide your employees health insurance. Those employees are employees that go to the exchanges or just go to a private company to get their health insurance. Or, like my firm, we still offer health insurance for as long as it's going to be available to us, to our employees. We're still doing that. But we don't have to under the Affordable Care Act because we only have about 27 employees. That's the employer mandate. But any employer above 50 and above 100 and up to 250 employees, all the rules have been shifted now down the road to 2015 and 2016. That just happened this week.